Hello and welcome to YouTube channel Health Cube, the place where my mission is to motivate you to look at the bright side of the health. In today's video, we are going to talk about Parkinson's disease and its management with the help of physiotherapy. So if you are interested in knowing about it, make sure to watch this video till the end. Let's begin. If you are suffering from Parkinson's disease, you must be knowing how important physiotherapy is in order to not only prevent you from secondary complication that very commonly comes in Parkinson's disease, but also to help you maintain a good quality of life. But are you aware what are the basic principles behind which physiotherapy management is designed? Or else what are the core exercises that you should incorporate in your Parkinson's disease in your day-to-day life, so that you stay as much active as possible? Let's understand the basics behind how physiotherapists design an exercise program for you so that you can live an active and good life. Parkinson's disease management is not very different from other conditions management. But yes, there are certain principles that has to be kept in mind before starting any of the exercise program for Parkinson's disease patient. If you know these principles, even you will understand how important are exercises for you, what are the benefits that you will get by doing these exercises, and you will also get some general idea what kind of exercises you should do and what kind of exercises you should avoid. So, first let's understand what are the principles behind designing an exercise program for Parkinson's disease patients. First, it should be always kept in mind that exercises should be started as early as possible. So the day when you have discovered that you have got Parkinson's disease, the same day or else immediately you should start your exercises. This will not only help you in preventing the secondary complication, but will also elongate the lifespan in terms of your ability. Since Parkinson's disease is a progressive disorder, like every single day the condition gets bad and bad, and also there are many side effects that are involved with the medicines that you take for Parkinson's disease. With the help of exercises, when started early, you can delay this process. You do not need to depend on so many medication and you can maintain a good and healthy lifestyle. Participation in regular physical activity from the early phase itself will help you to maintain your stamina, to maintain muscle strength and flexibility, and also will keep your morale boosted up. The second principle is you should always keep yourself under the guidance of a therapist. Regular assessments are very important. These assessments will not only help you but your physiotherapist also to get an idea how you are progressing, in what area the focus should be more, in what body areas the focus can be kind of limited. This will allow you to prevent yourself from the deformities and secondary complications like walking difficulty, loss of balance very easily. These assessments will also be helpful for the therapist to make priorities for management guidelines. Your management goal may vary on a monthly basis or else even quarterly basis based on these assessments. The third principle that you should keep in mind, or else your therapist will keep in mind while designing exercise program for Parkinson's disease, the exercise should mimic your functional level. What do I mean by that? Definitely, all the exercises that you should do should mimic some or other way your day-to-day task. This allows you to stay as independent as possible. As you must be knowing that in Parkinson's disease, due to musculoskeletal impairment, stiffness, rigidity, tightness, and body aches and pains, your ability to do your day-to-day function gets hampered. So, whenever you do exercises which are mimicking your day-to-day task, that will help you to stay active and will also allow you to do your day-to-day chores very easily. For this, community. Yes, you should always stay in touch with like-minded people and the people who are also going through similar problems. And the sense of community allows you to prevent yourself from social isolation, which is very common in Parkinson's disease. Even in one of these studies, it has been proven that depression is one of the biggest complication or else health problem that Parkinson's disease patient experiences throughout their lifetime. When you are in collaboration with your healthcare professional and you are also surrounded by like-minded people or as the people who are experiencing similar problem as you, and when there is healthy discussion happening among yourself, you would be able to find multiple solutions and you will also not feel isolated. The next principle is collaboration with other healthcare professionals. You should not only depend on physiotherapist for your overall recovery, your neurologist, your dietitian, your occupational therapist and your speech therapist also play a very important role. It's always good to collaborate with them. Share your limitations, your impairments, all the challenges that you face in your day-to-day life with them so that they can help you out in coming up with a proper solution. And the last and the most important principle of management of Parkinson's disease when it comes to exercises is doing exercises at community or as at home level. What do I mean by that? You should not only depend on a physiotherapy center and go do exercise over there, you should equally stay active and do your exercises at your home or else at your community space. This not only allows you to adopt the things that you have learned with your physiotherapist, but it will also allow you to explore certain limitations that you have so that you can then again go back to your therapist, discuss those limitations, those impairments, and work on improvising them on a regular basis. So keeping these principles in mind, physiotherapy exercises are designed. So what are the different types of exercises that you can do in order to maintain first a good muscle strength and flexibility, second good amount of independence in your day-to-day life, and third a good sense of holistic health and well-being. These are certain exercises that your physiotherapist might prescribe. So the first exercise set are general physical activity. General physical activity are nothing but regular movements or else activities that you can do on a day-to-day level which does not require much of intervention or as much of supervision. These activities can be in the form of walk, in the form of jog, in the form of static bicycling that you can do at home. You can do treadmill walking, even you can go for swimming. All these general exercises or as activities will be helpful for you to maintain a good level of physical health and well-being. Apart from that, you also need certain set of specific exercise programs. Now, specific exercise programs, as its name suggests, focuses on specific body area. For example, if you are experiencing more stiffness in your back region, especially in your lower back region, you need certain extra set of exercises that focuses on your lower back area. These specific exercises not only focuses on maintaining movement in that area but also helps to reduce pain, stiffness and other impairment related issues. You should also focus on doing some alternative exercise regime like yoga, pilates or else any other kind of workout that is helpful and is safe for you. Your physiotherapist, by doing your assessment and understanding your lifetime and your previous life experiences, will suggest you which is the best kind of workout regime or its format that is fit for you, which you can use in order to achieve and maintain a good level of health and well-being. Even the exercises that you learn or else whatever things or whatever movements that you are learning via the exercises has to be incorporated in day-to-day act. For this, what your physiotherapist will encourage you is to do mental rehearsals. Mental rehearsals are a very good way to imagine movement and prepare your body to perform a movement in a more accurate way. Even your physiotherapist might suggest you to use some feedbacks or cues like your visual system, your sensory system, your proprioceptive system and your hearing ability. These feedbacks allows you to do your movement as perfectly as possible. And last but not least form of exercise is home therapy. Home therapy exercises are the exercises that you do at home or else at community setting. These exercises should incorporate things that are present in your home environment. You might not have dumbbells or else equipments which are very easily present in physiotherapy centers. So your therapist allows you and helps you to use certain products or else tools as props while doing exercises. These props should be easily available at home and should be safe to use. With these things in mind, your exercise programs are defined. Trust me guys, if you follow the exercise program on a regular basis, if you follow the principle of exercises on the regular basis, you can improve your quality of life that has been significantly impacted due to Parkinson's disease. Through this video, my motivation was to make you aware why it is important to go for physiotherapy treatment after Parkinson's disease diagnosis. It can tremendously improve your quality of life. It can prevent you from falling into that bad depression, and it will also help you prevent from other secondary complications that might impact your independence at tremendous level. I hope you found this video informative, helpful and motivating. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.